In your new self-help book, Changeology, which I really liked, you describe 5 steps to realizing your goals and resolutions. What motivated you to make your research findings available to the general public in a reader-friendly way?
Well, Lisa, as we know, people are desperate for behavior change, and yet most self-help resources out there are pitiful. Over 95% have no research attesting to their effectiveness as a standalone self-help resource. So some self-help resources get people inspired for 7 or 10 days, but then just leave them discouraged, not certain what to do. And yet other self-help resources give maybe 1, 2 methods that might be somewhat helpful. So after 30 years and millions of dollars of federal research grant, I decided to update our stages of change and make it available to people. So I do want to yell it from the rooftops. People can change. Science can help you. That's the whole thrust of Changeology. As the title says, it really is the science of behavior change.
So you're taking the principles that you've learned from psychotherapy research and applying them to self-help. And
self-help. And self-change. Going back 30 years ago, beginning with my research with Dr. Jim Prochaska, we've been investigating how people change on their own without psychotherapy, with a little bit of psychotherapy, only in psychotherapy. There's this wonderful continuum of change. We need not think about self-help and psychotherapy as antagonistic. They're quite complementary. In fact, Jim always likes to say psychotherapy is professionally coached self-change. So it's all synergistic. What we know how people change on their own and what we know from how people change with the assistance of psychotherapy, all that converges.
You've published quite a bit on self-help that works. How do you integrate self-help into professional treatment? So what's the integration of the two?
We've conducted 12 national studies to try to decipher what does and does not work. Of course, there's not lots of research out there, but we leverage what is there. And then when there isn't the research evidence, we've asked almost nearly 5,000 clinical and counseling psychologists for which books, autobiographies, and films they use. So in the best tradition of evidence-based practice, we use the best available research. We combine that with clinician expertise, and we then apply that in the context of patient preferences, values, and characteristics. And that really comprises self-help that works. And as you indicate in your question, I've also been writing about how to integrate self-help into psychotherapy. Now, at first blush, most people will say, well, that's kind of oxymoronic, right? If it's self-help, then if you're seeing a professional, but again, that's that antiquated, discarded notion that there's psychotherapy here and self-help here, as though they're discrete categories. It's how people change. So psychotherapists increasingly integrate self-help into what they're doing to give additional detail, to show the theory and rationale, to help with homework assignments. Sometimes self-help is used when someone's on a waiting list, or it's used on the other end to engender maintenance and generalization of change, secured in treatment. Still, other people have access to only quite brief psychotherapy, and they, of course, are living like the rest of us in all of life's vicissitudes. So they can't cover everything in an hour. So whether it's assertion or parenting, dating, raising children, retirement, death anxiety, all those life challenges, self-help can be seamlessly integrated along with psychotherapy.